and we're going to bring in right now the director of the CDC, that is Dr. Thomas Frieden. Sir, thank you very much indeed for joining us on this particular occasion, sir. Am I right in saying that the original source of the E. coli contamination has not been identified? Is that correct?
That's correct, and that's not unusual with outbreaks, particularly if you have a large number of items that are included in a single meal, because it's quite hard to track that back weeks or months later.
Would I be right in saying that you can get rid of E. coli by using irradiation, but that is not currently in use widely in America?
There are lots of different ways to get our food supply safer. It's already quite safe, but we have to look at every aspect from the farm to the table to make sure that we're looking at the processes and reducing the risk of contamination at each step.
But again, sir, am I right in saying that irradiation gets rid of it? But there is opposition to using irradiation from environmentalists in particular.
There are some roles for irradiation in some food instances, but not for everything. There's no quick fix here. We have to fix the system at every step of the way. And one of the things that we're seeing more in recent years is more of these multi-state outbreaks as the quick service establishments spread and as people get more of their food from them. We consolidate our food supply. We consolidate basically the possibility of a single point of failure resulting in an outbreak.
Doctor, there is another scare that I want to ask you about, and that's the Zika virus. Again, I'm asking for information here. Is it correct to say that we now have a case where Zika was transmitted sexually within America? Is that accurate?
We have seen actually previously one case of apparent sexual transmission of Zika years back, so we know it's possible. And we had reports yesterday from Dallas with a test confirmed in our laboratory at CDC of someone who was not a traveler developing Zika, presumably, apparently, from sexual transmission. The bottom line still with Zika is that it's overwhelmingly spread by mosquitoes, and the key lesson, the key message is that if you're pregnant and you're thinking of traveling to a place that has Zika spreading, don't go. If you're pregnant and you live in a place where Zika is spreading, use mosquito repellent, protect yourself, stay indoors, air-conditioned space if you can, to reduce the risk that you'll get bitten by a mosquito.
Doctor, we thank you very much indeed for appearing with us this morning. Very important material. Thank you, sir.
Thank you.